It's no secret that vitamin B1 is crucial for many neurological functions in both the body and the brain. But here's a lesser known fact. There are two different forms of B1. One of these forms is imperative for anyone who has prediabetes or diabetes, and this same form is the only type of B1 that can prevent the development and the progression of peripheral neuropathy. In this video, I'll review the two different forms of B1 and how they differ. I'll reveal which form every diabetic should be taking and which form is critical for nerve repair. Coming up. Hi gang, I'm Dr. Valerie Montero, leading expert in peripheral neuropathy and more importantly on how to overcome it. My mission is to empower each and every one of you with the information you need to get back on the road to recovery from peripheral neuropathy and to be able to start living life again. If you're new to my channel, click on that subscribe button and also on the bell so that you can get notified as soon as I publish new content. Today, I'm going to cover the importance of B1. I'll explain why this vitamin is absolutely necessary for anyone that has prediabetes, diabetes, heart disease, or peripheral neuropathy. Make sure you watch this video until the end because I'm going to tell you exactly which form of B1 you need because remember, there are two different forms, and at the end of this video, I'll tell you exactly how to take it. So let's get started. First of all, why do we need B1? Well, vitamin B1 is essential for converting carbohydrates into energy, so it's necessary for mitochondrial function. But there's another reason it's important, and that's to maintain the nerve tissue of the brain and the peripheral nervous system, as well as maintaining the integrity of the blood vessels of the heart. As I mentioned earlier, vitamin B1 can exist in two different forms. One form, known as thiamine, is water-soluble, and this is the one you'll commonly see in a B-complex vitamin. The second type of B1, known as benfotiamine, is fat-soluble. Now, thiamine is naturally occurring in many foods, such as organ meats like liver. You can also find significant levels of it in wild-caught salmon. However, farm-raised salmon has much lower levels. Other foods rich in thiamine are clams, mussels, flax seeds, nuts, fruits, squash, asparagus, beans, green peas, brown rice, and brewer's yeast. But here's a scary fact. Thiamine listed on supplement labels doesn't actually come from any of the whole foods that I just mentioned. In fact, most thiamine found in supplements comes from China, where it is derived from toxic substances like coal tar, ammonia, and acetone. Now, doesn't that sound wonderful? This is not made up, folks. This is absolutely true. So let's talk about benfotiamine. This form of B1 is synthetic, and normally you'll always hear me say to stay away from synthetic supplements. However, this is the one exception to the rule. Benfotiamine is very safe with no side effects, and better yet, it has far better absorption into nerve cells than thiamine. I'll get deeper into that in just a moment. Now, let's talk about the relationship that these two B vitamins have with each other. Benfotiamine is the precursor to thiamine. This means when you take a benfotiamine supplement, it'll convert to thiamine inside of the cells. So the question you might be asking yourself is, why not just take a thiamine supplement to begin with? Well, remember I said earlier that thiamine is water-soluble? Well, this poses a big problem when you're trying to get vitamin B1 into your nerves. The protective outer layer of the nerves are made up of fat. Because thiamine is water-soluble, it can't effectively penetrate into the peripheral nerves due to this fatty outer layer. On the other hand, benfotiamine is fat-soluble, so it can easily pass into the nerves and penetrate very deeply. As a matter of fact, benfotiamine has an absorption rate into nerve cells that's 3 to 5 times higher than that of a thiamine supplement. Once inside the cell, the body will then convert benfotiamine to its natural counterpart, thiamine. This allows higher levels of thiamine to be utilized by your nerve cells and many other cells that rely upon it. Next, let's talk about how benfotiamine helps repair peripheral nerve damage. Benfotiamine will prevent and block oxidative stress leading to the damage of the nerves. So the main question is, what drives this oxidative stress that causes nerve damage? Well, here are some of the main driving factors. The first one is elevated glucose, and this can be from prediabetes, and that's when your fasting sugar levels will range between 100 to 125 milligrams per deciliter. Or it can certainly happen with full-blown diabetes, and this is when your fasting glucose is at 126 milligrams per deciliter or higher. Now, when you have high amounts of glucose in the body, it causes huge amounts of oxidative damage to the cells, and the nerve tissue is highly susceptible to this damage, which can result in its breakdown. But I want to be clear. Both benfotiamine and thiamine will decrease oxidation. However, benfotiamine takes it a step further. Benfotiamine has the unique ability to block the formation of AGEs, or advanced glycation end products. AGEs are formed when you combine glucose or sugar with a protein or with a fat, and then you expose it to heat. This creates these sticky proteins known as AGEs. So, for instance, let's say you take some ribs and you cover them with barbecue sauce, which, by the way, is loaded with sugar. Then you throw them on a grill to cook. You've just taken a protein and slathered it with a sugary sauce and set it on fire, or exposed it to very high temperatures. These delicious ribs you may love to eat are now loaded with AGEs, leading to greater oxidation and potential nerve damage. Now, let me take just a minute to further blow your mind. Did you realize that ice cream is loaded with AGEs? What? Well, we all know that ice cream contains a lot of sugar. Then you have the milk protein and fat. But where does the heat come in? Well, here's what I never stop to think about. All ice cream is pasteurized. This means it's exposed to heat for at least 30 minutes. Bam! There are your AGEs. The problem is these sticky proteins cause major damage to your peripheral nerves, your eyes, your arteries, and your brain, the other nerve tissue, remember? Now, here's where it gets interesting. Benfotiamine is the only form of B1 that can help reduce these AGEs. Thiamine doesn't have this ability. And here's another bonus. Benfotiamine also helps your cells become more sensitive to insulin, which will decrease your level of hemoglobin A1C. This is extremely important not just for diabetics, but really for anyone eating a standard American diet. This is a diet that's low in fiber, low in fruits and vegetables, and very high in saturated and hydrogenated fats and sugar. Also, you've probably never been told that the higher your blood sugar levels are, the more depleted your vitamin B1 levels would become. These are all reasons why anyone with elevated glucose levels should be taking benfotiamine. But even if your blood glucose levels are perfectly healthy, you may still be experiencing oxidative stress leading to peripheral neuropathy from other things like pharmaceutical drugs. Now, I'll leave you a link in the description box below with a list of the many medications that can cause this. Also, chronic exposure to ordinary environmental chemicals can lead to this type of damage. So we're talking about chemicals like cigarette smoke, lawn and garden chemicals, chemicals sprayed on farm crops that you eat, household cleaning chemicals, insecticides used inside your home or outside your home, and also insecticides that you spray or rub directly into your skin. And this list goes on. I could do an entire video just based on this topic alone and how it affects our health. Now, the next thing that's important for you to know are the causes of B1 deficiencies, which will result in oxidative damage leading to peripheral nerve damage. So we're going to start with a diet consisting mainly of white flour, wheat flour, white sugar, and white rice. By the way, this will also cause B6 and B12 deficiencies, which are also critical for the health of your peripheral nerves. Other things that can lead to this damage are carbohydrate-dominant diets. Also, things called sulfites. Sulfite consumption, this is a preservative used in sandwich meats and in red wine, can lead to this type of damage. Excessive consumption of coffee and black teas. Also, chronic alcohol consumption. And I'm not just talking about alcoholism. I'm talking about regular alcohol intake. If you want to find out how much alcohol you can safely drink, watch my video on alcohol and neuropathy. You can click on the banner in the corner with the eye on it, and it will take you directly to the video. Other things still are gastric bypass surgery that can cause a B vitamin deficiency. Irritable bowel diseases, Crohn's, and ulcerative colitis, which are inflammatory bowel diseases, can lead to B1 deficiencies, and diuretic medications. These are usually prescribed for high blood pressure and fluid retention. Also, this may surprise you, but pregnancy and lactation can lead to B1 deficiencies. Also, diabetes and prediabetes, kidney dialysis, and hyperthyroidism. Now, let's discuss some of the amazing benefits that you'll experience by taking Benfotiamine. Clinical studies have proven that Benfotiamine can decrease nerve pain, assist in peripheral nerve repair, improve numbness in the feet or legs or the hands or arms, improve the speed of nerve conduction. That's how fast a signal will travel up and down the nerve. It can also improve insulin sensitivity, reducing your hemoglobin A1C levels. Benfotiamine can protect the kidneys from elevated glucose, protect the eyes from elevated glucose, and improve diabetic retinopathy. And it can also increase your natural thiamine levels, as we mentioned earlier. Benfotiamine does a phenomenal job at decreasing inflammation in brain cells, and it protects the brain against dementia and also Alzheimer's. It improves circulation and blood vessel health. Now, this is important for people with heart disease as well as those suffering with peripheral neuropathy, because the peripheral nerves deeply rely upon healthy blood vessels and good circulation in order to get oxygen and other nutrients to the nerves for repair and regeneration. And lastly, Benfotiamine reduces alcohol cravings. And here's the question you've been waiting for me to answer. So, how much Benfotiamine do you need to take to get all of these benefits? Well, research shows that you should take between 500 to 600 milligrams per day. But it's best if you spread it on out throughout the day. So it would be best to take 250 milligrams to 300 milligrams twice a day. Studies have shown that 70% of neuropathy patients taking Benfotiamine will have a significant reduction in their symptoms. Also, taking Benfotiamine with methylcobalamin B12, pyridoxal 5-phosphate B6, along with R-alpha-lipoic acid and acetyl-L-carnitine will have an even larger impact on protecting your nerves and improving your recovery from peripheral neuropathy. Remember, Benfotiamine is the building block of vitamin B1. It has the best absorption into nerve cells, and it can protect both your brain and nerves against the damaging effects of elevated blood sugar, prescription drugs, and environmental chemicals. Thanks for watching. If you enjoyed this information and want more like it, be sure to subscribe to our channel, and don't forget to like us because it really helps our channel grow. Also, please share this information with anyone you know who's suffering with peripheral neuropathy. I look forward to seeing you on the road to great nerve health. Blessings.